Hi, I'm Dr. Amy Krambeck. I am the Edmund Andrews Professor of Urology at Northwestern Medicine Feinberg School of Medicine, Department of Urology. I'm also the Director of the Division of Endourology. Today, I would like to present a case of a 70-year-old gentleman who underwent HoLEP. This gentleman, who had previously undergone an aquablation or robotic water jet therapy 18 months prior for lower urinary tract symptoms. After his procedure, he suffered from recurrent urinary tract infections that were symptomatic, foul-smelling urine, burning with urination, urinary incontinence to the point that he was wearing Depends, and on chronic antibiotic suppression therapy. He also had resumed his tamsulosin or Flomax to help with his voiding symptoms. When I saw him, I attempted to perform a cystoscopy in the office, but his prostatic urethra was almost completely obstructed with scar tissue. He had a significant amount of residual prostate tissue left, and determined that he would be best served with a holmium laser enucleation of the prostate. So he underwent a HoLEP procedure that was uncomplicated. Because of the obstruction at the bladder neck, I cannot do my standard 3-lobe technique. I had to do a modified in-block technique, starting just proximal to the viru and freeing up the apex and anterior plane first. But I was then able to completely enucleate the prostate tissue, and 189 grams of tissue was removed. So it was a much bigger prostate than anticipated. He went home the same day after a successful voiding trial. He was able to urinate 3 times before discharging home from the hospital. And at 1-week follow-up, he reports minimal to no incontinence. The urge incontinence had almost completely resolved. No urinary tract infections, no hematuria, excellent stream, and dysuria had resolved. So he's extremely happy with his result. I think this case highlights the role of HoLEP. HoLEP is not only a primary treatment for BPH, but also works extremely well for patients who have undergone previous procedures that maybe were complicated or did not turn out the way anticipated. It's refreshing to know that you can do a procedure that will produce the same excellent end result regardless of what the patient has gone through prior to that point. And you should always keep HoLEP in your back pocket as a procedure that can help these patients that have difficult clinical scenarios.